Hello and welcome to the program. I'm your host, Neal Howard, here on Health Professional Radio. Our guest in studio is returning to speak with us, Dr. Leah Millheiser, Clinical Assistant Professor in the Department of Obstetrics and Gynecology and Director of the Female Sexual Medicine Program at Stanford University Medical Center. She's here with us today to talk about some common myths that are related to female sex drive and desire, and maybe offer some guidance and resources for women to take control of their sexual health. Welcome to Health Professional Radio, Dr. Millheiser.
Thank you for having me.
You know, last time when you were with us, we talked about some of the 4 forms of female sexual dysfunction. Let's talk now about some of the common myths that you seem to encounter in your travels when you're speaking and teaching and whatnot. What are some of the things that just drive you nuts and you wish that more of us had an understanding of when it comes to FSD or female sexual dysfunction?
You know, I think that's a great question. I think 2 of the more common myths that I hear has to do, one with sexual desire in women, and the second is has to do with achieving orgasm in women. So I would say the first myth is that, if a woman isn't always in the mood for sex, then there must be something wrong with her. And that is probably the one thing that drives me crazy. I've had women come to my clinic and actually say, I didn't really feel like I needed to come see you today, but my partner, and it's typically a male partner, wanted me to come in because he thinks there's something wrong with me. And when I ask them what it is, the answer is always, my desire isn't always there. I'm not always in the mood for sex. His desire is much stronger than mine, so there must be a problem. If you ask the majority of women, are you bothered by your low sex drive? And, we know that it's very common for women as they age, as they take certain medications, if they have certain medical conditions to experience low sex drive during their life, they'll say no, because I know that it's a result of this issue. And I know that if I get into a sexual act with my partner, even if I'm not in the mood, that I'll develop desire along the way and I will ultimately enjoy the experience. That is pretty typical for a woman throughout the lifespan. Medications like birth control pills, medical conditions like hypothyroidism or depression, breastfeeding, going through menopause, all of those experiences can affect a woman's sexual desire. I think men, oftentimes tend to look at desire from their own construct. So how do I think about desire? And if that's the way it works for me, then that's the way it should work for my female partner. And unfortunately, that isn't the case. So what is the norm for women, especially if they've been in a relationship for a long time, and especially if she is, experiencing these life stressors or changes, is that she will have waxing and waning desire. It won't always be spontaneous, but usually she'll be able to develop that responsive desire during a sexual act. And many people say, well, why do women engage in sexual activity if they're not in the mood? Well, there's many reasons and incentives. One is a woman wants to feel close to her partner. She wants to feel good. She knows she will feel good. She wants to make her partner feel good. So there are incentives and reasons that women engage in sexual activity even if their desire is low. But I think it's really giving women and their partners that information that spontaneous sex drive is not always there for women like it is in men.
When it comes to starting the conversation about FSD with your healthcare provider, you say that misinformation or lack of education in healthcare providers adds to the understanding gap among patients. Do you find that female practitioners sometimes have just as big a disconnect when it comes to FSD as their male counterparts?
That's a really great question. I'm going to say that I don't think it's gender specific. I think it's been a problem in medical education. Unfortunately, it wasn't made a priority over, the last 15 years, but in the last few, it has. We're seeing more and more medical schools putting more hours into what female sexual dysfunction is. So I think we're seeing improvement across, in both genders when it comes to healthcare providers and how they're approaching sexual function with their patients and how they're addressing it. And I think there has been an improvement. Also the treatments have changed over the years. We have more solutions available now. And I think that really opens up a door for a clinician to say, I feel more comfortable addressing sexual function because there's something I can offer my patients.
With drugs such as Cialis and Viagra available for men, women seem to be much more complicated when it comes to, you can't just pop a pill and everything is okay in that area with men. Are there any drugs that are available, or are we talking about therapy in women? How do you address the situation?
So we always want to be able to provide solutions. Mm-hmm. And you bring up a great point. With Viagra's and the Cialis of the world, it really is, you take a pill, you either have an erection or you don't. It's very clear, objective evidence. Mm-hmm. With women, there are so many factors that contribute to her low sex drive. It could be, a imbalance in brain chemistry. It could be relationship issues. It could be medications or medical conditions that she has. You really have to tailor the approach to treatment based on what the factors are. So there's no one size fits all. Oftentimes women who have had long-standing sexual dysfunction will need counseling, emotional counseling, to, either deal with issues that they themselves have been encountering as a result of their sexual dysfunction, specifically emotional concerns. And also they may need a treatment to address the physical issues. So we tend to not treat one thing in isolation. You'll find that women who have a desire disorder may eventually develop an orgasmic disorder or an arousal disorder. So I always say, go after what the first concern was that woman has. And oftentimes the other issues will go away, but we tend to treat from a multidisciplinary approach. Oftentimes that can be seeing a clinician for a medication, seeing a sex therapist or a relationship therapist, seeing a pelvic floor physical therapist. So there are so many great solutions available to women today to treat their sexual dysfunction.
When it comes to menopausal women and premenopausal women, does menopause always mean that you will develop FSD? And if you're premenopausal and you have FSD, does it always mean that you're going into menopause before your time?
No. So there's no link between sexual dysfunction and premenopausal women being related to early menopause. When we talk about going through menopause, this really is a change in the hormonal environment for a woman. Mm-hmm. And what we see is a decline in serum estradiol levels or estrogen levels and testosterone levels. We know that estrogen and testosterone are both important for vulvovaginal health. So without estrogen, we see vaginal dryness that can lead to sexual pain. This is quite common. It's a part of something called genitourinary syndrome of menopause. Mm-hmm. So we see this quite commonly in postmenopausal women. In terms of testosterone, when testosterone starts to diminish, even before menopause, women will experience a change in their level of sex drive, and it becomes almost more pronounced after menopause. Not all women are bothered by it. Women will say, yeah, I have vaginal dryness, but I'm not sexually active. It doesn't really bother me. Some women will say, sure, I have vaginal dryness and I use a lubricant and it's fine. But for other women, it's devastating. It has devastating effects on their relationship, on their own, personal self-esteem and body image, and needs to be addressed. So many women who are postmenopausal will notice a sexual function concern if they are sexually active. But I think what's important is it's not just about menopause and beyond. We see these issues starting in women as young as in their late teens and 20s. So we really shouldn't ignore younger women, millennials, and women who are, Generation X, who have sexual concerns.
Well, you've been listening to Health Professional Radio. I'm your host, Neal Howard, with Dr. Leah Millheiser, talking about FSD, or female sexual dysfunction, and some of the common myths that are out there about female sexual dysfunction. And she's been with us dispelling some of those myths and setting us on a path of understanding. It's been great having you here with us today, Doctor.
Thank you so much for having me.
Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to this podcast on iTunes.